Good afternoon, respected judges and my dear colleagues. I thank PCSF for giving this wonderful opportunity for presentation. Our patient, a 17-year-old male, he presented to us with breathlessness since 5 days and low-grade fever since 2 months. And on examination, he was found to have cardiogenic shock. Heart rate was around 120 beats per minute with a blood pressure of 86/50. This patient, he had deranged lab parameters with severe anemia and leukocytosis, but the blood cultures were negative. His X-ray showed a large globular rounded radiopaque shadow in the center of the cardiac silhouette, and we suspected a presence of an aneurysm, could be from the LV or the RV. So the echo showed the presence of there was a presence of cavitatory enlargement just posterior-basal to the left ventricle, and this cavity was having a communication with the left ventricle. So the cavity was nothing but a submittal aneurysm, and it was seen just below the mitral valve, and there was multiple communications between the cavity and the left ventricle, and this cavity was also resulting in causing mitral regurgitation for the patient. So these were explaining the symptoms of heart failure and breathlessness since 5 days, and along with the low-grade fever, which was explained by the superadded infection. So we did a cardiac CT as well, and we confirmed that there was a large submitral aneurysm, which was just below the mitral valve and also impinging on the left atrium and the left ventricle. And this was same in this same CT. We also performed coronary CT, which we saw that the coronary arteries were normal. However, the left circumflex artery, the branch of the left circumflex artery was just the PLVB branch. It was just anteriorly displaced. So we also performed one cardiac MRI just to rule out any infarction being caused by the aneurysm. The cardiac MRI images also confirmed the presence of submitral aneurysm, and there was a clear communication seen between the left ventricle and the submitral aneurysm. So our patient, after getting treatment with IV antibiotics for around 2 weeks and normalization of creatinine, he was taken up for surgery and underwent a resection of the aneurysm. So points to remember over here are submitral aneurysms are quite rare, and the etiologies which are postulated for the presentation for the formation of this are either acquired or congenital, but congenital are most likely hypothesized to be the cause. So because of a weakness in the posterior portion of the subfibrous annulus of the mitral valve, there can be formation of these mitral aneurysms, and also
Ma'am, your time up. Please conclude.
Yeah, please, Dr. Sfurti, please conclude.
Sir, submitral aneurysms are rare and they can have varied presentations, including heart failure and sepsis. And I would like to emphasize that this can be a rare differential for a patient who is young and presenting with heart failure and mitral regurgitation. And the definite treatment is resection, but the perioperative outcomes have been, they are rare and they can be varied.